In chapter 7 of my book, I describe the lower body pulls as I learnt them from Jando Masuero. Iliac spines back and wide, sitting bones to the back of the knees, pubococcygeals forwards. And they brought me immediate benefit. I was very excited with them, and I've shared them with a lot of people since, and there's been tremendous amount of benefit gained from doing these. Stability, strength, opening, and so on and so forth. But I also began to identify a few problems with them, and I'd like to describe an alternative way of approaching them. I had a couple of pupils, both of whom had quite severe lower back issues, who when we did these pulls, it put them into short-term but intense pain, which was worrying. And I began to be alerted to the fact that even though these pulls were doing great things for many people, they might not be working to the full biomechanical ease that we are always looking for with Alexander technique. And then I worked with some other people, including some teachers, who just could not find these pulls at all, and others who just couldn't do them comfortably. And then I began hearing about when people have diastasis recti, where the rectus abdominis pulls apart, such as towards the end of pregnancy, that physios work with that by pulling in that direction. So I began to play with that with my pupils and the teachers I was working with, and we discovered a lot of benefit from doing that. Let's start by doing the pull as we've been learning it up till now. I pull the iliac spine back and wide, and of course here we're talking about the anterior iliac spine. So just do that with me. I pull my iliac spine back and wide. And what do you notice? You probably notice that it widens and flattens the belly, which is great, and it widens and opens the back, which is also really great. But is it truly fluid at this point? Or is there actually a bit of tension across the front of the belly, particularly the lower belly? Is it immediately easy to move forward from these, or is it pulling one back? Does the breath flow easily, or does it sort of flow more easily upwards, but it's harder to get it down into the legs and into the very lowest part of the body? I think I've ended up having to work quite hard to get the breath back down here. And also some people have noticed that it can tighten the deep hip rotators. So let's just keep those pulls going for a moment as you walk. Just pull the iliac spines back and wide and keep those going as you take a walk. What do you notice? Strength, stability, openness. Is it actually easier to walk forwards or backwards? Some people have commented it's easier to walk backwards with this because forwards these pulls are actually pulling one back. They're not allowing one to flow completely easily into movement. Just note that. And certainly I noticed quite early on when I was doing these, because my work with the Miss Goldie work up till now had been to engage with the world, and suddenly these backwards pulls seemed to be pulling me back from the world and bringing me more back into self-awareness. So that also was a question mark for me that's been going on a long time. Think about how muscles pull. Anatomists define a direction of pull for every muscle by defining their origin and insertion points. And say the biceps is said to originate in the shoulder and insert on the lower arm. The insertion pulls towards the origin, and that's the direction of pull. But physiologically, there's no reason why a muscle can't pull in either direction. And it's really down to which end is more fixed. If this end of a muscle is more fixed and the muscle contracts, this end will move towards it. But if this end is more fixed, then, and when the muscle contracts, this end will be pulled that way. So just try that with the bicep. If you hold your forearm still and then think about contracting the bicep, it will pull the shoulder down towards the bicep, towards the elbow. So the muscle can actually pull either way. So let's play with pulling the transverse abdominis in that direction. So where does it attach? Well, we've talked about the fact that it attaches to the iliac spine at the front, and it also then attaches to the iliac spine at the back, all the way along the iliac crest, in fact. So if you find your anterior iliac spine, which of course is properly your anterior superior iliac spine, the anterior one, the inferior one's a bit lower down, and then you trace along your iliac crest all the way to the back, and you'll find another bony protuberance at the back, and that's your posterior iliac spine. Again, also your posterior superior iliac spine, but since we're not dealing with the inferior ones, we'll just call them posterior and anterior. And if you do that on both sides, you'll notice that the posterior iliac spines are closer together at the back. The anterior ones are at the front. They're either side of the sacrum. Okay? So now just thinking to pull that posterior iliac spine round and back to the front iliac spine, and it can help to brush the fingers in that space between the iliac crest and the ribs, which is where the transverse abdominis runs. So just encouraging it with a brush. I pull my posterior iliac spines round to the front iliac spines towards. That's it. And what do you notice? Do you notice it widening the back? Do you notice it still flattens the tummy? So we get the same results that we were after when we pulled them in the other direction. And then what's different? Let's keep pulling them from the back to the front. Is the belly softer than it was before? Is there more give, more elasticity? It's activated but yet more elastic. What about the back? What about the breath in the back? Again, is there more elasticity there, more movement of the breath in the sacrum and lumbar area? Do you notice whether it moves more freely up into the body, opening up into the mid-back, even into the upper back, that the breath can flow all through? And also down into the legs, down into the bum cheeks and down into the legs. The deep hip rotators are engaged but not tightened. It also seems to encourage us to do that screwing the ankle movement I describe in chapter 8, that back and up of the inside ankle, that realigns the feet. Just stay with that a moment. So many people have noticed that the whole back can be engaged with this movement, leaving it more fluid and breathing and engaged and widening. I think it engages us into the obliques, it engages us, which widens the middle back. It also engages us more into the serratus anterior, which is engaging the upper back, and that of course then links more easily to the elbow pulls. So it's integrating the pulls together. And all this is embedding us in our backs, strong and secure in our backs, from which we can include the volume of the body, and then from there include the world. It orients us forwards, from which we can receive the world, and yet also having our embodied presence and also receptivity at the back. Try walking with this direction. What do you notice? Just thinking those posterior iliac spines round towards the front iliac spines and walk with it and see how it is compared to earlier. We've still got the back widening and opening as we walk. Is it more or less fluid? Is it more or less easy to walk forwards? What about walking backwards? Can we still walk backwards with this? Oh, yes, we can. Okay, what did you notice? So now, having discovered one could reverse muscles, I was then intrigued to explore the hamstring pull again because, again, though pulling the sitting bones to the back of the knees is a lovely, strong, stabilising move that stabilises the pelvis, I could often feel quite tethered down with this move, and it's quite hard to keep it going in movement. So what happens if we reverse this one as well? So let's start by exploring it together. Just find your sitting bones and think to pull the sitting bones to the back of the knees, and you'll probably notice that it draws that the pelvis downwards, brings it more vertical, stabilises everything. But how easily can you move from that point? And so I dealt with this by introducing that upflow up the back of the legs to counter the down of it. One then has to put in a counter move to allow it to move. So let's try reversing the pull. So instead, think about taking the backs of the knees up to the sitting bones. Just pull back to the knees, up to the sitting bones. And what do you notice? Is the pelvis drawn down in exactly the same way, but is there now more lift in the system? Is it more easy to move from this place? To me, it makes it much more easy and fluid with the body, and one then doesn't have to think up from the heels because it gives us this uplift, but yet there is still a stabilising down. So it brings in both up and down in a much more natural way. And now let's think about the pull to the top of the sternum that we do up from the sitting bones, because again, come back to the old way of doing it, where we pull the sitting bones to the back of the knees and then pull the top of the sternum up away from the sitting bones. And again, it brings a lovely sort of strong sense, but how fluid is it? Let's do it the new way. So shake everything out and think, pull the backs of the knees up to the sitting bones, and now I pull the top of the sternum away from the sitting bones and let it somehow add in that fluid sense of coming from the backs of the knees. Does that now bring a drawing up that comes sort of right more from the base of us, and again from which it's more easy to move? So let's put all the pulls together now. Not doing them, just repeating them out loud, but not actually doing them yet. I pull my posterior iliac spines round towards the anterior iliac spines. I pull the backs of the knees up towards the sitting bones. I pull the pubococcygeals gently forwards. I pull the elbows outwards, forwards and down. I pull the wrists back to the side of the body. I pull the top of the sternum up away from the sitting bones and away from the backs of the knees. Now give your 3. 1, 2, 3. Okay, and let's take that into a lunge. And up again. Is it easier to keep these directions going as you go into the movement and as you come out of it again? Because these directions are now all moving in the forwards and up direction that we need, in which we are moving, in which we are aiming always to move. It's taking them into life. And you can try the backwards pull as well in the same way. but they are continuing to take us forwards and up, even as we're going into movement, even as we're stepping backwards. Have a go at a squat. Again, give another 3. 1, 2, 3. And keeping that sense of everything coming again forwards and round into your squat and out again. And just go as far as you're comfortable going, however far your squat is going at the moment. Once again, just say the directions again. We pull the posterior iliac spines round towards the front iliac spines. I pull the backs of the knees up towards the sitting bones. Pubococcygeals gently forwards. Elbows outwards, forwards and down. Wrist back. Top of sternum up, away from the sitting bones and away from the backs of the knees. 1, 2, 3. And then again go into your squat. How's that? Just keep thinking that forward and round. And the body just flows more easily. Now let's take that into walking. Again, posterior iliac spines round towards the front iliac spines. I pull the backs of the knees up to the sitting bones. I pull the pubococcygeals gently forwards. I pull the elbows outwards and forwards and down. Take the wrists back and pull the top of the sternum up away from the sitting bones and away from the backs of the knees. 1, 2, 3. And let's walk. So we've got the stability with these pulls, but they're taking us forwards as we move. I think there's more ease in it, more fluidity. And what about the spatial awareness of the room as you walk? Is that you are walking into the room and receiving the room as you do so, so there's less separation. I think this all reverses our usual polarity of self-work. That usually we start from our fronts and we work towards our backs. We start from our heads and we work towards our base. And we start from ourself and we try to include the world. And what we've done here is reverse that. We're finding our back through this pull and then bringing it round to the front and out to the world, where the circling movement gives us our volume and makes us into a receptive bowl, enabling us to receive the world into us and receive the room as we walk into it. And we don't have to find ourselves and then find the world. We're finding them both together. And this, to me, feels much more natural, much more aligned with our quest of how we were evolved to move. Thank you.